Hi everyone, Georgia here again. You're seeing a lot of me today. Deputy Editor at Aesthetic Medicine. Welcome to our third session of the day, on day 2 of our virtual event. I'm joined by Dr. Victoria Manning, who is Clinical Director at River Aesthetics. They have a few clinics over the southwest England, and Victoria is here today to talk to us about preparing for unprecedented body contouring demand once we all get out of lockdown. She is speaking today on behalf of Cutera. Hi Victoria, thank you very much for joining us.
Hello there, thanks for the introduction, Georgia.
So what we're going to do is, so Victoria has a presentation plan. So in a minute, I think we're both going to pop our cameras off and she will talk you through the presentation. If you have any questions for Victoria, if you can just pop them in the chat box to the right of your screen, then I'll come back on at the end and we will ask the questions. But yeah, I think with that, if you're ready, Victoria, then I will hand over to you.
Thanks very much indeed for that introduction, Georgia. Hi, everybody. Thank you for joining us for the next sort of 25 minutes. My name is Dr. Victoria Manning. For those that don't know me, I'm one of the clinical directors of River Aesthetics. And as Georgia kindly said, we have clinics in the south coast, which at this time of the year is lovely if we were actually allowed to go out. I'm also one of the KOLs for Cutera. And this afternoon, I'm going to be talking a little bit about preparing for post-lockdown demand, and also our 360 approach to non-surgical body contouring. So what I'd like to cover this afternoon is what was our rationale behind getting yet more devices when we already had other body contouring machines? What's the current market opportunity? I'd like to introduce truSculpt Flex and truSculpt ID, for those of you who haven't heard of them, and why combination treatments are key now. And the most importantly, how we engage with our patients right now in this really uncertain time, but in an ethical manner, and how we embrace this change, this new normal, how we build confidence with our patients, and how we plan for our comeback whenever that may be, which is the million-dollar question at the moment. I believe that we actually have quite an ultimate solution for kind of post-lockdown body concerns with the truSculpt duo. I've got my little Batman and Robin there, and also the 360 approach, which I'm going to talk about shortly. So what has lockdown done to us? We need to kind of look at the bigger picture here. Some people have really embraced this. They're exercising, they've taken, a healthy interest in their diet, they're exercising, they're going back with this new vigor. But unfortunately, I think the majority of people are bored and they're locked down and they're risking quite a lot of weight gain by drinking extra alcohol. I'm guilty here. We bought the 365 days of cocktail making, and currently we're going through quite rapidly. And we're all eating more more processed foods. So what can we do to make our country more healthy again when we go back? So excuse the pun here, but we're going kind of from couch COVID to a more healthier lifestyle, as well as a more toned body, because we don't know when we're coming out of this. It could be June, July, we just don't know. So we've got a lot of things to bear in mind. So let's look at the problem and then flip it on its tail and actually look how this makes quite a phenomenal market opportunity for us. Looking at obesity, these are stats from the National Heart Forum, looking at forecasts for obesity in 2020. And be mindful, these figures came out before we were hit with COVID and with lockdown. So these are pre-COVID stats. So I'd be interested to see how they've changed, obviously following the lockdown. But from what they originally forecast, 8 out of 10 men are going to be obese in 2020. 7 of us women out of 10 are also going to have higher BMIs and be classified as obese. This is frightening, really scary statistics. And why? Because of the impungent sort of healthcare cost. 5% of the total NHS spend is on obesity. And at the moment, when we're trying to free up NHS because they're doing, an amazing battle with COVID, we need to be able to help the NHS in reducing this impact of obesity. 4.2 billion per year is spent on obesity, including diseases related to obesity, such as diabetes, heart disease, and colorectal cancer, and 2.3 billion directly attributable to treating obesity itself. You may ask why this is so important. Type 2 diabetes, heart disease, Alzheimer's, cancer, and COVID-19, apparently unconnected conditions, but all have a common denominator, and that is one of inflammation. And inflammation has been identified in quite a few recent studies as a key driver in COVID-19, and explains why the elderly and those with lifestyle diseases are more at risk. And we know that obesity triggers inflammation. We also know that overweight people have higher levels of inflammatory messengers called cytokines, which interfere and damage normal cell function. So we know that eating too much and not exercising enough makes you overweight and then obese. But why? We also know that obesity is an inflammatory disease, and inflammation plays a greater role in the downward spiral to obesity than more people realise. So this is really, really important. So looking at fitness generally and the health and wellness industry, why is this important? The opportunity, all this health and wellness, fitness and beauty and body is a huge, huge market sector, and it's actually growing more than the GDP, with 595 billion being spent on fitness, mind and body. These figures absolutely astounded me, when, you know, more than cars and cosmetics. So a huge, huge market opportunity. And we know this concept doesn't work for everyone. So eat less, move more. Yeah, it's fine for some, but we know it doesn't work for everyone. And we know that some people need a little bit of help. So the key fat facts: we have a fixed amount of fat cells in our body. These body contouring treatments, sorry, we've just flipped ahead one. Body contouring treatments aim to eliminate permanently, but if I've got an issue with my thing here. But if our patient is not following a healthy diet and they're not exercising regularly, they are going to put on weight. So let's look at the 360 approach to body contouring, and why, as medical practitioners, we need to be adopting this approach. We have to be ethical. We have to think about other factors outside someone coming in to see us and just saying, I don't like this little bit of fat. I don't like this bulge. I'd like a bit more muscle. We have to be ethical. You know, we have to see the bigger picture. And from what I've just explained, lifestyle measures have a huge impact on A, success of our treatments, and B, more importantly, the well-being of our patients. So like we always do, we all take a thorough history, but we need to be taking a dietary and exercise history to identify our patients' lifestyle factors. And we need to take a detailed assessment of their expectations and why are they having treatment. And also, some patients will need hormone profiling. So if we're looking at potential causes of weight gain, are they menopausal? Are they really stressed? Do they have a thyroid dysfunction? So we need to be thinking much more holistically now. We also need to be taking, obviously, pre-treatment photography, weighing our patients, and also doing volumetric measurements. So measuring is really, really important for documentation purposes. We also need to make sure that we're offering something else. So in our clinic, what we are also doing for everyone coming in with a higher BMI, we are now offering nutritional support to basically support their body goals and health, whether or not so we're looking very closely at diet, what are the patients trying to achieve, and how we can support that. So whether it's muscle growth or whether it's fat loss, we need to be looking at that. So we're offering a dietitian appointment, and we're doing different packages for patients depending on that, their desired need. We're also adding lifestyle advice in the form of fitness. So giving patients exercise regimes. Do they want to build muscle? Are they trying to, do more in the gym? Are they toning? What are they actually trying to achieve? And then the most important things, we need to follow these patients up. We know our patients, we all get sort of cued in on these fad diets, and we're doing really, really well. And then we give ourselves a pat on the back and we think, okay. And if no one's constantly giving us a little bit of a boot up the backside, we kind of regress and we go back to what we were doing before. So it's really important that we assess these patients, we test these patients, we treat these patients, and then we reassess these patients. So they're constantly coming into a clinic, so we're constantly improving the journey. So how can Cutera offer the complete body sculpting solution with truBody? So this is a phenomenal duo, and it really does offer a complete body sculpting package. So using truSculpt's ID, it's hands-free solution with a monopolar RF to permanently destroy fat cells, in addition to immediately after being able to use truSculpt Flex for muscle sculpting. And you'll see in a second how this combination treatment is key and how we can maximize results. And patients will see sculpting and muscle tone improvement in as little as 12 weeks. And some of the patients we've seen and treated are actually having results even after their last treatment at 4 weeks. So I don't know how many of you have heard of truSculpt ID. It hasn't been around a while, but we are relaunching it into the UK, and I have to say it's quite a phenomenal bit of kit. As I said, it's monopolar, so designed for the reduction of unwanted excess fat pockets and bulges, which we all have at the moment. But for us, it's quick. It's a quick 15-minute treatment. But the key point for us in this clinic, it's not BMI dependent. So you're able to treat all BMIs. So we have some machines in clinic that obviously, unless they've got pinchable bulges of fat, we couldn't treat them. Or if they had too much fat, we couldn't treat them. And we were losing this cohort of patients. So now we can treat all BMIs, all skin types. We can treat over to 2s, non-pinchable fat, and skin with laxity. And on average, we are getting about 24%, I think, of thickness reduction per treatment. However, in my experience, this is increased quite phenomenally when combined with the Flex. It's unfortunate we had the machine in February, so we had, I think, about 7 weeks of combined treatments until we had to lock down. So I'd be really excited to see when we do open up, the final results of the patients we've treated and how much fat they've actually lost when we can go back to work. In addition, obviously, it's hands-free, so operator independent. And you can use 6 hand-free handpieces. So you can treat multiple areas at one time, which is exciting. It has a real-time temperature control, so you're heating the epidermis up to 43, but basically causing the adipose tissue beneath going up to sort of 47 to 48 degrees, which means that you're getting permanent apoptosis. I'm just gonna, this is Gemma, who is our esthetician, and as you can see, she's very slim, but she had a little pocket of fat at the bottom of her tummy that she didn't like, and this is her just chatting about her experience. So here we go.
Shoot. Hi, so I'm Gemma, I'm an esthetician at River Aesthetics, and we're so excited because we've just got the Cutera truSculpt machine here in clinic. So I'm just trying it out on my torso area. So currently just having my lower abdomen done. It's very comfortable and just feels like warm pulses, and it only lasts 15 minutes. And yeah, I should get 24% fat reduction as well. Wish you.
So really nice to see, we can use it on all individuals. And this is yours truly being treated in a very unsightly position, looking at submental fat. For those that know us, we do an awful lot of thread lifts, and quite often patients just have that little extra under the submental area, which just needs tightening before we can get a really good result with using sutures. So having a 15-minute really quick procedure, which is painless, is fantastic for us. So this has really been very popular in clinic. So looking at what's next. So now let's look at the Flex machine. If those of you that were at AM Live at the beginning of March, you may have seen us there. This is quite exciting. So we all want a sculpted toned tummy and a lifted bum, and without hitting the extra hours in the gym. But you might say it's too good to be true. But honestly, I'm not just saying this, I believe it's unlike anything else on the market. It's personalized, it can adjust to your fitness level, your shape, and your goals to strengthen, firm, and tone your muscles. But really importantly, it increases your BMR, which actually works to obviously burn up some visceral fat as well. So really exciting. So this is what the new kid on the block looks like. It's a small machine with 16 applicators. So as you'll see shortly, we can treat multiple areas. So how does it differ from other kind of categories? So we've got you've all heard of TENS, which is just tickling the surface of the muscle. And then we progressed to EMS, which was going slightly more, slightly deeper, but still in superficial muscle. So you're really restricted by how far you can go down before you get pain, which is obviously one of the limitations. And then we have flex, which is the multi-directional stimulation. So as you can see, you get full penetration of the muscle, which means you can get to quite high intensities without causing any discomfort. So looking at the two main technologies for muscle sculpting, we've got the electromagnetic muscle stimulation, and then we've got truSculpt Flex. I think as you can see from here, you've got with the electromagnetic muscle stimulation, you've got an indirect energy field of energy cast in a general area. Whereas with the flex, we can actually direct channels of energy into specific muscle groups. We can change the intensity, we can change how they fire, so we can actually change the direction, we can twist, we can contract, we can shorten, and we can treat up to 8 different muscle areas in one go. I mean, as you can see here, so you've got unique muscle isolation, you've got change in modes, and you've got better return of investment because obviously you can treat more patients. So I don't know if you can try this, but a fit adult, I'm told, can perform 100 crunches before reaching a point of exhaustion. I think I can probably do 10. But during a 45-minute flex treatment, you can actually perform the equivalent of 54,000 crunches. That's quite impressive. And obviously you're going to feel it the next day with some delayed muscle onset soreness. But, you know, if you're doing 54,000 crunches, you'd be worried if you didn't feel anything. So a little bit more about it. Pre-programmed with 3 treatment modes, prep, tone, and sculpt. We're offering different contraction sequences to stimulate basically a traditional workout, but with more intensity and an increase to your BMR. And we can deliver 3 treatment options, replicating an intensified crunch, squat, and twisting action. So basically what this is doing is continually confusing and challenging the muscles so you don't plateau. So great for people that are going to the gym anyway, but they've just reached a plateau and they can't progress further. So we can help these patients too. So looking at the first mode, the prep mode, this is basically a warm-up. So for people that aren't going to the gym, we can stretch your muscles before a workout, and you're warming up with a twisting motion, and you're basically preparing them for the next 2 treatments. So as you can see, a little twisting motion of the muscle. And then we go on to the tone mode, which is basically stimulating to build muscle strength and endurance. So it's basically like doing an amazing plank, holding you to the point of exhaustion and then releasing you. And boy, do you know about it. And then finally, you have the sculpt mode, which is really fast, deep contractions to increase your metabolic rate, to basically give you more definition in the treated area. So moving on, I love this image because it actually explains exactly what's happening, because it's quite hard to explain. So prep mode, you're just kind of warming up, and then you do 2 sessions of those, and then potentially tone mode. So this is basically doing strength conditioning exercises, changing the replications, changing what you're doing, initially over a 30-minute period. You then have to turn the machine down before you go into the HIIT mode, which is basically high intensity training, and you have 15 minutes of this in the tone mode. And boy, do you know about it. You then have 2 sessions of sculpt, so 15 minutes of the conditioning exercises, and then 30 minutes of HIIT exercises. And it's comfortable. I wouldn't say it's the most enjoyable thing in the world, but you know you've done a workout. And it's interesting, the more muscle bulk you have, the lower intensity you actually need to actually get to your goals. Looking at the ultrasound pictures here, you can see you're getting a 30% increase in muscle thickness, and also it looks like the fat has contracted. Basically what's happened is the muscle hypertrophy has just squished the fat, And if you then went in again with the truSculpt ID, you've got a much higher percentage of fat per surface area in one area. Hence what I was saying earlier, once you retreat with ID after flexing, you actually get a much greater degree of fat loss. So this is what it looks like when it's in situ. And then just showing you the treatment sessions that we've been using. So for non-active people, you need two preps, 2 tones, 2 sculpts, so 6 treatments. With and we're at the moment we're doing an ID at treatment 1, and also the fat loss at treatment 6. But obviously, because we've only had the machine for 7 weeks, and then we locked down, I don't know yet what is going to be the most ideal going forward. And if you're active, you just need 2 tones, 2 sculpts, and then we're recommending a maintenance every 3 months, because if you don't use it, you lose it. So it's something just to bear in mind. And just to briefly cover just some before and afters, these are from some of my colleagues in the States. I think you can appreciate that's 12 weeks after 4 flexes, quite impressive results. So I just want to whet your appetites to show you what this machine can actually do. These are not my pictures, as I said, these have all come out from America, but all have shown quite significant improvement. Now this one I can claim our fame to. So this is the UK Cutera UK manager. So this is when we first got the machine, and this was after 1 ID on his abdomen and flanks and 3 truSculpt sessions. So he went on to have the full 6, and I'm looking forward to seeing his results. So Tim, if you're listening, be prepared, because I do want more photos at the end of this. But you can really see the difference in definition and the debulking, especially when we look at the side profile. That is quite impressive. So Tim, I have high expectations for you. This lady is post childbirth, so I think she was 4 or 5 months post, and very slim anyway, but she just wanted a little bit more definition. So she had 1 ID and 4 truSculpt Flex, and this is immediately after. And then you can see the debulking and the difference that has made. Just want to show you this one as well, slightly larger patient, but 1 truSculpt ID, and that was after 5 sessions of Flex. She's had a 6, and she's also had a 6 second ID, so I'm really looking forward to seeing her results as well. And this is again one of my American colleagues of the combination treatment. So you can see how combining the treatments, if you have a little bit more tissue, is really, really advantageous to us. So just to finish, what do we need to be doing now? We need to be ethical, I think, and I know a lot of clinics are actively advertising, what we can advertise at the moment, but we need to think about what patients actually want. So we're offering virtual consultations online. Our patients are loving it. And we're quite liking the contact with them, just reaching out to them, and that's really, really nice. And we're encouraging our followers to share their fitness and lifestyle tips. We had a river bake-off over Easter. Feels like we've been off forever. And we're posting their advice and tagging us in on their social media. But more importantly, we're educating our patients on how we can help them protect themselves, how we can improve their diet, how improving, obesity, weight management can reduce inflammation and protect you from COVID potentially. All these educational snippets. And as I said earlier, we've collaborated with a nutritionist and fitness instructor to offer kind of online advice as well for diet and exercise and health. And obviously newsletters to engage with our patients. So the future. So what does the future hold? We don't know regarding when we're going back, but we have a waiting list for both the truSculpt ID and Flex, and it's getting longer by the minute. We also believe in maintenance treatments. So as I said, every 3 months, I'd like someone to come in for a Flex. So we're recommending putting patients on Go Cardless, so that we know we've got a monthly fee coming in, and patients are actually signing up to this now. So I think to take on board, to go home with, we need to embrace change. We need to kind of change what we're doing. We need to build confidence with our patients, and basically we need to be planning our comeback and how we can help these patients in these obviously rather scary times. And at the end, love your curves. So thank you very much. Back over to you, Georgia.
Brilliant. Thanks very much, Victoria. That was great. I just want to say, I hope that was the slides were clear enough for everyone there. know that the slides weren't full screen, but I think it was hopefully all fine. Okay, we've got a few questions, Victoria, which we will go through. So someone has asked the cost of the treatment to the client, and I know this will likely vary depending on where you are and who you are, but I mean, how much, if you wouldn't mind sharing how much perhaps you charge?
No, exactly. I mean, so basically what we do, we're kind of doing packages, and we were the first clinic in the UK, as you know, to have the Flex and the ID together. So we were running kind of a slightly cheaper, just to see, we were trying to get results through. So, but now when we go back, we will be offering the Flex for 4 to 6 treatments between 2,000 and 2,500. So it's cheaper than some of its competitors, but we also want to be able to be more accessible to the larger market. So we were trying to price point it at a point that was affordable. I know that some of the London clinics are a lot more. Obviously, they have different overheads, but I think around the 2.5 combined with the ID is probably reasonable.
Okay, great. Someone's asked a similar question, but specifically looking at the tummy area for a fit/active person, but I guess that will be down to a consultation.
Yeah, I mean, so a fit active person wouldn't need the ID, and they just need 4 treatments of Flex. So they could just have 2 tone and 2 sculpt treatments, and that's all they need, and with fantastic results. And quite often, most people who have their tummies done, they're like, when they finish that course, they're like, oh, can I have my bum and my glutes done as well? And it gets addictive. And the interesting, it's been really popular with the men as well. So guys are coming more, and then it opens up, and I guess, another kind of repertoire of treatments in the clinic as well.
And are there any contraindications?
Yes, there are. So obviously we don't treat pregnant and breastfeeding patients. We don't treat anyone with any sort of, especially with the Flex, any heart conditions, or anyone with a pacemaker in, because obviously the electrical impulses, we don't know the effects. But to be honest, but apart from that, and we don't go over bone with the ID, because it can be a little bit uncomfortable. But apart from that, no, it's a really, really good treatment. And obviously we don't treat over, excuse me 2 seconds, we don't treat over broken tissues. One thing it's fantastic for with Flex is we're using it in people who've had children, and they've got divarication of the recti muscle, where the tummy muscle obviously splits, and it's been shown to actually really improve that as well, which is great. And we're also, before we locked down, we're starting a trial with using people who, for rehab purposes, that are now non-weight bearing, and they can't put weight on that joint, but you can stop muscle atrophy by just gently stimulating the tissue. So when they can start weight bearing, things are much, much better.
Okay. Someone else has asked for an idea of machine cost, and obviously we will give you Cutera's details to get in touch with them directly to talk about that. But I know there's a lot of kind of muscle stimulation devices around at the moment, especially launched recently. It seems to be the kind of hot new body contouring technology. But I guess for someone who's maybe deciding or trying to weigh up between a few machines and deciding what to take on, what would your advice be in terms of making sure that they're really making the right decision before they part with that cash for their clinic?
I think making sure you've obviously got the demand, that's really, really important. But go and try different machines. I think that's really important, and see what you're actually trying to do. I mean, we wanted basically a multifaceted approach. We wanted to be able to treat patients for aesthetic reasons. So we wanted to be able to tone, do all the thing, that sort of thing. We also wanted to make sure that we could hit the people who were going to the gym anyway, so we can actually improve their performance as well. But we also wanted to do the rehab part of it as well, because we're working obviously with postural fitness instructors, people with back pain. We wanted to be able to specify which muscles we were treating, and at the moment the Flex is the only one that you can actually specify different muscle groups. All the rest are just, larger heads, kind of blasting generally. So you can't kind of isolate different muscle groups. And for us, it's really fun because before COVID, we could actually treat 2 people at once. So if a couple came in, we could actually have both being treated, and they can both have their tummies done. So actually, as a time thing for clinics, that's fantastic because you're getting double revenue, and they're happy because it's reducing the amount of time that they're in clinic. So for us, we looked at all those 3 markers. But we got that machine in addition to everything else we've got, because we've got cryolipolysis, we've got cellulite treatments, and it was a bit of a battle with the clinic when I first proposed getting these machines. Well, we've got all this, it's just diluting what we've got. And it was like, no, it's opening up another market, because patients that we were previously turning away, we can now treat. So we can treat, younger people with little bits, pockets of fat, or, that we couldn't get in a vacuum cut, or we couldn't. So it actually works with these other machines rather than against them. That makes sense. So for us, it was a really good, decision to get the machines, and it has brought in a much younger demographic, because we're obviously known for our threads getting our 40, 50, 60-year-olds that probably aren't so much into muscle sculpting, but this has opened up a much younger demographic, so we've got more of a market share now. So for that, it's been fantastic.
And just thinking about that as well, in terms of managing expectations with this kind of technology, for patients who would perhaps come in and they're not quite in the sort of bracket yet where they can be looking at a weight reduction or like a tightening with this kind of device, with the training that's involved with the Flex, for example, what's kind of said or taught about managing clients' expectations in terms of who's actually suitable for treatment, because that presumably comes into it a lot.
Yeah, absolutely. With anything in aesthetics, patient selection is key. So someone who's coming in with a BMI of 30, for instance, or 35, ain't going to get fantastic results and get the pictures that I showed you earlier with the 6-pack. They're more likely to get a family pack. But that's why I was saying it's really important to be looking at that holistically. About managing weight loss generally, doing diet, and actually, but you can always improve. So we can use obviously the truSculpt ID, or you can debulk first, then go in with the ID, and then Flex. It's a journey, and we have to manage these patients' expectations, and that's really, really, really important. But it's just, it's a plan, isn't it? So what the patients are actually trying to achieve. But as medics, we have to be looking at the bigger picture and actually making sure that we are looking after their health as well as what they look like.
Yeah, absolutely. Because as you said, that's kind of comes down to your ethical practice as well, doesn't it? To have the best intentions for your patients overall. Okay, brilliant. Someone else was just asking how much you charge per treatment. If you wouldn't mind repeating how you do things at
Okay, so for the ID, we charge which is the fat loss. We charge £500, and then if they do need a second treatment in 12 weeks, we will do that included in that cost. It's a 15-minute treatment, so once you've got everything in a system, we block out obviously a half hour initially for the consult and doing the initial bits, and still half an hour for the 15-minute treatment, because the time you faffed around and done it and got the patient out. So £500. However, if it's combined with the Flex machine, we basically do a package. So they get, whether they're having 4 or 6, depends whether it's 2, 2.5 included in that. And then we're putting patients on a monthly retainer, so they're paying an amount of income to us as a clinic, and then every 3 months they can come back and get their top up of the Flex. It just guarantees income, and also you want to, as I said earlier, we want these patients to be constantly coming in, so you can monitor, see how they're doing, if there's anything else they need, which is really important.
Great. Okay, thank you. I think that's probably all we have time for. What we will do, if anyone has any other questions that they want to direct at Cutera directly for information, you can do that. You can find contact details on the event page on the Facebook event page for Virtual Week, and we can get those answered for you. And Victoria, do you want to just mention again, for if anyone wants to get in touch with you or follow River Aesthetics on social or anything like that, where they can find you?
Yeah, so if you want to find us at river_aesthetics on Instagram, or at River Aesthetics on Facebook, and I put a lot of stuff on my personal feed as well, which is at Dr. Vix Manning. So we're always promoting and doing various demonstrations on our social as well. So if you want any more information, please you can email me and contact me at victoria@riveraesthetics.com, and I'm more than happy to answer questions.
Brilliant. Well, thank you so much. Thank you for that, Victoria. And thank you for joining everyone else. Yes, so we will see you all later for, we have one more session today, two more sessions today, and then we have sessions all week for Virtual Week. Victoria, hopefully you can join us for some other sessions you might be able to as well. And yeah, thank you so much for joining us, and thanks again, everyone.
Bye guys, thanks.
Bye.